Myth: snoring is normal. Fact: while occasional, soft snoring is okay, regular loud snoring can signal obstructive sleep apnea. OSA. In OSA, the airway collapses, stopping breathing repeatedly during sleep, sometimes hundreds of times a night. This causes poor sleep, daytime sleepiness, morning headaches, poor concentration, irritability, and a higher risk of accidents. Untreated, OSA increases the risk of high blood pressure, diabetes, heart disease, and stroke. If you gasp or choke in your sleep or feel excessively tired during the day, see a doctor. A sleep study can confirm OSA. Treatments include weight loss, CPAP devices, and lifestyle changes. Snoring is a warning sign. Get evaluated and treated. Better sleep equals better life.